The Distinguished Alumni Award is the highest award given by the School of Public Health. It recognizes an alumnus or alumna with a demonstrated record of distinguished service and achievement in any discipline of public health. These alumni have made humanitarian contributions and have had significant impact, reducing suffering, improving health and well-being, and advancing social justice through research or practice. They've also demonstrated exceptional resourcefulness, innovation, and creativity. Recent awardees in the last few years include Mary Bassett, the New York City Health Commissioner, Robert Newman, a leader in the global fight against malaria, Michael Phillips, a pioneer of mental health in China, and Chris Elias, President of Global Development at the Gates Foundation. This year is especially exciting because tonight's awardee and lecturer is also a UW Regent. Rogelio Riojas has devoted his career to providing quality, affordable health care and access to jobs and education, especially for Latinos and migrant workers. Now, according to my script, in 1978, he founded CMAR Community Health Center, but earlier today, he took pains to correct me, insisting that he was part of a team that founded CMAR. The clarification he offered speaks volumes about his commitment to teamwork, his inclusive style of leadership, and his humility. But I can safely say that he has been a leader at CMAR for over 35 years and currently serves as its president and CEO. From its initial King County location, he has expanded CMAR to 11 counties in Washington state, making CMAR one of the nation's largest community health centers. Based on an inspiringly broad view of service, it offers the people it serves not only medical care, but dental care, mental health care, substance abuse treatment, low-income housing, long-term care, farm worker housing, and more. CMAR offers care to all, without regard to race, ethnicity, immigration status, sexual orientation, or ability to pay. Rogelio is also a passionate believer in the power of education to create opportunity for the diverse leaders of tomorrow. He leads a university scholarship program that recruits and mentors students who are the children of migrant farm workers. He oversaw the development of the first community family practice residency program in partnership with Swedish Hospital and UW. In 2012, he received UW's Charles Odegaard Award, which honors a community member whose leadership sustains the former UW president's distinguished work on behalf of diversity in the UW and for citizens of the state. In 2013, Governor Jay Inslee appointed Mr. Riojas to the UW Board of Regents, making him the first Latino on the UW Board of Regents ever. He is a leader in the field of public health, a dedicated community advocate, and an inspiring example of the impact of School of Public Health alumni in ensuring the well-being of communities. I'm about to welcome him to the podium. After he speaks, we'll have a Q&A session moderated by Ron Sims, another public health visionary and hero. Please write down your questions during the talk, and our advancement team will collect them toward the end of the lecture. Please join me now in welcoming tonight's lecturer and 2016 School of Public Health Distinguished Alumnus, Rogelio Riojas.
Good evening, everyone. Thank you for coming this evening. I know that you have a busy schedule and another night to hear me. I really appreciate that very much. Thank you, Dean Frumpkins, for that wonderful introduction. And I also want to thank you for the great work you do for the School of Public Health. So let's give him a round of applause. I am honored to be here among students, faculty, and friends to be recognized as the School of Public Health 2016 Distinguished Alumnus. This is quite an honor for me and for my family. I'm proud to say that I am an alumnus of the University of Washington. I love this institution. That's one of the reasons why I wanted to be a regent, because the University of Washington has done so much for us that I am very grateful for the work that they do. We all know that the University of Washington has been advancing the economy of the state for many years. It's educated hundreds of thousands of the state's teachers, doctors, dentists, scientists, business leaders, and many other professionals. But in the 1960s, the Latino community consisted of mostly farm workers. There were very few Latinos professionals. The University of Washington has been responsible for transforming many of the farm workers' children to become professionals by giving them an opportunity to get an education. Today, Latinos have a thriving professional community because of the investment the University of Washington made on them. And I am an example of that. I'd like to share my background and how I got to be a student at the University of Washington. I come from a large family of 12 children. We came originally from Texas, Edinburgh, Texas, which is a small community in the Rio Grande Valley, right next to Bronzeville and the border of Mexico. In the early 1950s, we started migrating to Washington State to work on the farms. We worked in Washington State from March to July, thinning and cleaning sugar beets and picking strawberries. We would then leave to California to pick grapes, peaches, olives, and oranges until November, when we would go back to Texas. I must have attended at least 10 different schools. We followed the migrant stream until I was 14 years old, when my father decided to stay year-round in Othello, Washington, making it possible for me to graduate from high school and attend college. I'm the 8th of 12. My older brothers and sisters, they didn't have that opportunity. What happened to them is that they needed to leave school in order to help support the family. You can imagine that 12 kids and 2 parents, that's a lot of mouths to feed. And so I'm very grateful to them because my older brothers and sisters made it possible for me to be able to get an education. I was accepted at the University of Washington to the special education program. Of course, you know, there was nothing special about me or some of the students that came in that program, but it later became the Equal Opportunity Program. I did not have the grades to be accepted through the regular admission, so I was admitted through this affirmative action program. I arrived at the University of Washington in the fall of 1969. The university, like many universities in the United States, was experiencing student turmoil and unrest. The country was in the middle of the civil rights movements and the protests to stop the Vietnam War. These were very interesting times to be a student. The Reverend Martin Luther King, the great leader of the civil rights movement, had been assassinated the year before. The African American community and its supporters were fed up with this country's lack of progress to end segregation and racial discrimination, so they were fighting back. As a Latino, I could relate. Growing up in Texas, I had witnessed discrimination firsthand. As many of you know, Texas is a very conservative state, and the level of discrimination against people of color, even today, is unacceptable. You can imagine what it was like back then when I was growing up. I can recall stopping at a restaurant in West Texas and being turned away. I can remember the sign on the door with the marking, "No Mexicans allowed." Of course, it had other derogatory language on the sign that I cannot repeat. Racial discrimination was common in this country, but especially in the South. At the same time as the civil rights movement was taking place, the Stop the Vietnam War movement was also in full effect. This war was viewed by students as unjust because the war had been going on for too many years, and the students felt that the government did not have a strategy to win or to exit the war. Yet, many soldiers were being killed, including our friends and family. The casualties also included a disproportionate number of soldiers who were people of color. As a young person coming from a rural area, the civil rights and the Vietnam movement were all new to me. These movements used the strategy of civil resistance and involved the act of nonviolent protest and civil disobedience. This strategy was embraced by university students all over the country, including the University of Washington. I too embraced both movements and got involved in trying to make changes in social justice. I got involved in peaceful marches to support civil rights and to stop the Vietnam War. Together with a group of students, we peacefully took over University of Washington offices, including the president's office. I don't think President Kause would appreciate that much, but we did, in an attempt to increase minority students and faculty at the University of Washington. The students got involved in community activities. As an example, we tried to shut down the construction site at Seattle Central Community College because the construction industry would not hire minority workers. We took over an abandoned school in Beacon Hill area that later became a Centro La Raza. We also got involved in the United Farm Workers movement to unionize farm workers to improve wages and working conditions by boycotting grapes and lettuce. Just about every Saturday, we marched outside the local Safeway and urged customers not to buy grapes at the store. Minority students made a significant difference helping the university to accept and embrace diversity. I learned a lot by participating in the student activities. I learned that social change does not happen by being passive or expecting others to create change. Change happens by taking the bulls by the horn, getting involved with others, and fighting for what is right. This experience inspired me to finish my education at the University of Washington and molded me to who I am today, an advocate for social change. I hold undergraduate degrees in political science, economics, and a master's degree in health administration. I majored in political science because I wanted to be a lawyer. I thought it would be the best way for me to give back to the community. That changed when during my junior year, I went to work on a summer job with United Farm Workers Union and the Yakima Farm Workers Clinic in Eastern Washington. I was a union organizer for the union and a community advocate for the clinic. Soon after starting the job, I learned that the health center was opening a clinic in the Tri-Cities area. So I asked the executive director to consider opening the clinic in my hometown of Othello. I explained to him that the enormous need for health care in this community and that doctors would not see Medicaid or poor patients. I informed him that patients from Othello had to travel 80 miles to Toppenish to get health care. I was ignored, of course. I quit my job and moved to Othello to organize a grassroots effort to petition the federal government to direct the Farm Workers Clinic to open a clinic in Othello. We were successful. We looked for a Latino healthcare administrator to run the clinic, but we couldn't find one. Then we looked for any health administrator that wanted to move to a rural area. We couldn't find one either. That's when I decided that I could best help my community by becoming a health administrator, and I changed my career goal. The Masters of Health Administration in the School of Public Health was, and still is, one of the best programs in the country. During my time in the program, it was led by Dr. Bill Dowling, who was the director of the MHA program. The program teaches the students to become health leaders that can impact not only current health issues, but also future affairs of the healthcare industry. The program taught me to be a strong and effective healthcare administrator. The training included a summer internship that I did in Good Samaritan Hospital in Puyallup, and I completed a hospital survey at Stevens Memorial Hospital in Edmonds, Washington. After I completed the MHA degree, I decided to do an administrative residency at Central Washington Association, a hospital led by Tom Troy in Wenatchee, Washington. This was excellent hands-on experience and education for me. Even though my training was in hospitals, my goal was always to work at a community health center. Community health centers were born out of the civil rights movement when President Johnson declared war on poverty. At this time, millions of Americans living in inner city, neighborhoods, and rural areas throughout the country suffered from deep poverty and desperate need for health care. Community health centers bring quality health care to communities in need without regards to race, income, health insurance status, culture, or health condition. In 1965, federal funding was approved for 2 neighborhood centers in Boston, health centers in Boston and Mississippi. Today, there are 1,200 community health centers serving more than 24 million patients at 9,200 sites throughout the country. In Washington State, there are 20 community health centers serving more than 920,000 patients at 236 sites. For the last 37 years, I have served as Executive Director of CMAR Community Health Centers. CMAR is a community-based organization dedicated to serving the most vulnerable members of our community. All our clinics are mostly in Western Washington. We have some offices in Eastern Washington, but they're mostly in Western Washington, from Vancouver to Bellingham. CMAR's mission is driven by advocacy that reduces health and social disparities in our communities. CMAR was started with a grassroots effort very similar to the Othello Clinic. A group of University of Washington health sciences students and several community leaders recognized the need for bilingual clinic in King County. These students included, just to name a few, Sidney Gallegos, Renee Charles, Phil Martinez, and community leaders Jose Rodriguez, Gail Baker, Jesse Martinez, and Karina Knowlton. Jose Rodriguez, who was the executive director of Northwest Chicano Health, found a clinic to lease from Dr. Cheese. Dr. Cheese was the physician that wanted to retire, but was having trouble selling or leasing his clinic because it was in South Park, a very low-income community. It was a perfect location for a community health center. We received a federal grant, and CMAR Community Health Center was born. The name CMAR stands for Seattle Marysville. This organization took the name because there was also a community group in Marysville that was interested in starting a clinic in the neighborhood. The plan was to open up a clinic first in Seattle, then start a clinic in Marysville. Even though I was involved as a student in the effort to start CMAR, the federal grant was approved while I was working as an administrative resident in Wenatchee. When the executive director position became open, I didn't think I had a chance to be selected. I just did not have the experience to run an organization as an executive director. I decided to apply anyway because positions working at a community health center at that time were few. I was surprised when I got a call from Sidney Gallegos, who was a dental student and chair of the personnel committee, asking me to interview. To make a long story short, all other applicants either decided not to take the job or were not selected. So I was offered the job, and of course I took it. I was hired in June 1978. The budget of the clinic consisted of a $200,000 grant from the federal government and had a staff of 8 employees. The first year we saw 2,500 patients and provided 8,000 visits. Early on, we decided that our organization was not going to be dependent on one funding source and that it was important that our patients receive as many health services under one umbrella organization as was financially feasible. We decided that we were going to run the organization as a business and that we were going to use sound business principles to manage it. We also decided that our organization was not going to operate as clinics, using storefront facilities. Back then, a lot of the community health centers, there wasn't any money, and so a lot of them started up in storefront facilities. Instead, we began to treat our patients. We wanted to treat our patients in modern healthcare facilities, so we began to grow. Today, CMAR has 91 sites providing medical, dental, and behavioral health services, and providing a wide variety of health and human services, including WIC, MSS, long-term care, skilled nursing, inpatient and outpatient substance abuse, housing, Latino senior information and assistance, citizenship programs, and more. In 1988, we started a 6-member family medicine residency in partnership with Providence Hospital at Cherry Hill. We were the first community health center in the country that had a formal medical residency training program. The reason we started this program was because we were experiencing turnover in our medical staff, and we concluded that the high turnover rate was occurring because the residents were not being trained with a focus on community medicine. We were right. 95% of our family medicine graduates are either working for us, for another community health center, or they are teaching at an institution of higher learning. Since healthcare reform ensured more patients, there is a need to train more family doctors. CMAR is doing its part. We have recently been accredited by the Accreditation Council for Graduate Medical Education to start a new 18-member family residency program in Everett, Washington. We are partnering with Providence Hospital, and the residency is scheduled to start in June 2017. This is the first residency program in Providence Hospital in Everett. So we're very excited about that venture and looking forward to training more family doctors, not only for us, but for the rest of the state. Our organization is comprised of 6 nonprofits and 1 for-profit company. The financials of all the entities are consolidated under the CMAR Community Health Center organization. The for-profit company is Basan Architects. This firm is responsible for the architectural designs on all our facilities and also directs our construction crew on remodeling and rehab projects. Basan Architects has saved CMAR millions of construction costs over the past 15 years. During fiscal year 2015, CMAR served approximately 240,000 patients, and we provided approximately 1.2 million encounters. CMAR's combined revenues were a little over $200 million. Our patient profile is very diverse. 44% of our patients are white, 36% are Latino, 5% African American, and 15% other minorities. 70% of our patients are below 100% of poverty level. These patients are served by 2,400 employees who are highly committed to the mission of the organization. The Affordable Care Act has been great for our organization and great for our patients. There are an estimated 600,000 Washingtonians who were uninsured that now have insurance. CMAR has assisted 162,000 individuals over the last 2 years with insurance enrollment. We have enrolled over 50,000 of our uninsured patients, reducing CMAR's uninsured rates by 47%. We are currently managing 100,000 managed care patients in our clinic. CMAR has responded to this increased demand by opening up new clinics in our service area. As many of you have heard, healthcare is currently being redefined by the federal government and by third-party insurers. The current healthcare system in this country is not sustainable, and changes need to be made. The industry is moving away from fee-for-service reimbursement and changing to value-based reimbursement. This method of delivering care is not new to community health centers, since we have been delivering healthcare in a comprehensive way for many years. CMAR is committed to moving toward value-based care, and we are preparing to reach the triple aim of improving the health of the patient, the health of the population, and reducing costs. We are currently redefining our operations and processes to ensure that we place top priority on population health management. We are putting strategies in place to focus on clinical quality measures and are designing new methods to improve preventive health outcomes, chronic care conditions, and overall health of our patients. This includes using a team-based model of care where providers are supported by a team of clinical staff that help them take care of the patient. CMAR's goal is to be the provider of choice for our patients and for our employees. Looking back at my University of Washington education, the master's degree in health administration and the political science degree has helped shape my social views and priorities into concepts that have helped me become a strong community organizer and be an advocate for social change. This education has taught me the analytical skills that have been useful in setting the appropriate strategy for our organization. It gave me the foundation of knowledge that allowed me to be more confident, more courageous, and more effective. It contributed to my sense of leadership and ability to articulate my opinions in a way that can make change. That's why it's important to me to build CMAR as an organization dedicated to advocacy. I am very proud to tell you that our organization has been actively involved and committed to advocating for the poor at the state level since the very beginning. We have been raising our voices to legislators and policymakers, whether fighting for better access to health care for everyone, adequate housing conditions for migrant farm workers, or tuition assistance for undocumented children. We live in a world where human beings need to depend on one another to live in harmony as a community. Our country, or for that matter, the world, cannot survive if each one of us thinks of ourselves. In our society, there are many individuals who cannot make it on their own without the help of others. I'm talking about the poor, the homeless, the farm worker, or those that are in the margins simply because their income cannot support their families because they do not make a livable wage. As an organization, we asked ourselves the question, how can we best help those in need? The answer was simple. We have to advocate no matter the cost. Advocacy takes leadership, and effective leadership has courage. When discussing leadership, courage often does not get enough attention, and is one of the hardest to fully embrace and execute. How many times have we been involved in situations where we disagree with the group, but we decide that it's easier to go along with a consensus instead of raising a question or presenting a different point of view? Other times, the issues may be more significant, but yet we are still unwilling to challenge and go against the norm because we are afraid that there may be some personal consequences. An effective leader needs to learn to do what is morally right, no matter the consequences or price we need to pay. Of course, compromise must be made from time to time, but where social justice is concerned, courage is the key factor that allows us to change and take a stand. This is where real change happens. Let me give a few examples. A few years ago, Our organization was involved trying to find a solution to the lack of farm worker housing. This is an issue that affects our community, our patients, and public health. The growers in this state were complaining that migrant farm workers were not traveling to Washington to work on their farms because there was a shortage of housing. The growers proposed a solution to the legislature that involved the creation of farm-based housing using a substandard building code that would allow farmers to build housing with only 4 walls and a roof. These structures were not going to have floors, insulation, or wallboard. CMAR and other advocates proposed instead to increase funding to build community-based housing. The governor and the legislature were willing to put money in the budget to build community-based housing, but the growers opposed it. We were surprised to find out that the growers would not support the funding because they were afraid that if the housing was built, that farm workers would stay year-round in their communities. This was in the late 90s, early 2000s. I mean, you can't get more racist than that. The farmers wanted the workers to come, work on the farm, and then leave. The irony is that if you looked at Granger, 90% of the population there is Latino. If you look at Sunnyside, it's probably 75. If you look at the Tri-Cities, it's probably 90. If you look at Othello, it's another 80 or 90. So we were already here. It was really ironic. CMAR decided to organize a campaign to defeat the bill, and we were successful. The substandard building code was amended the following year, but changes were made to the law that guaranteed the family living in those units would be safe. And Representative Kinney was one of our leaders at the legislature. I want to recognize her. Fellas, please stand up or raise your hands. However, because these units were too expensive to build, the growers decided not to build any. Still trying to build cheap on-farm housing, the growers turned to the Department of Health and asked the department to allow them to build temporary tent camps on their farms. The Department of Health obliged and started to license unsafe camps. The licensed tents consisted of a tarp hung between 2 fruit trees. The stove was 2 bricks and a metal grill, and an electric refrigerator with no power in the middle of the field. Water was being supplied from a water hose connected to a farm supply, water supply. I mean, this is the Department of Health of the state approving these camps because the growers wanted it. And recall that the growers didn't want year-round housing or stick-built housing because they didn't want them to stay in their community. It was absolutely unbelievable that the Department of Health was issuing those licenses. These camps basically they resemble refugee camps in third world countries. And Lupe Gamboa, who is here, Lupe, raise your hand. He was one of the individuals also that was an advocate, and Ricardo Sanchez that was advocating for stick-built housing. All right, luckily for us, these camps were illegal because they did not meet federal OSHA regulations. After fighting with the state, it took us several years. We fought with the state for several years on this issue. The federal government stepped in and stopped the Department of Health from issuing tent licenses unless the tents met OSHA requirements. And OSHA requirements, they're like the military tents, and they're expensive. You got to have power, you got to have water, you got to have the necessary living equipment in those tents. And so the farmers once again, decided that that was too expensive for them. So they opted out once again. That left the growers only one alternative. And that alternative was community-based housing, so they started to advocate for it. The end result was that Washington State made substantial funding available to build community-based housing for the farm workers. Today, farm workers are no longer living in tents, and their living conditions have improved dramatically. Now, there's still some on-farm based housing up in the Skagit Valley. I mean, the ones that I lived on when I was a young man, they're still being used. They're not in good condition at all, but they are still being licensed by the Department of Health, but they're better than the tents that the farmers wanted to be an alternative for housing for farm workers. Another example that CMAR also led the effort to cover undocumented children in the state-only Medicaid program and cover undocumented workers in the basic health plan. These were two huge, big accomplishments. You see at the federal level, undocumented workers are not covered by Medicaid, and adults obviously are not either. This state, we're lucky we live in Washington. Washington is different than the rest of the country, especially the states in the South. And so we worked really hard to get the state to pay or to make eligible undocumented children for Medicaid. And we were successful. And that was a bipartisan effort. It was not just the Democrats that made it happen. These were two huge accomplishments that made the difference on the health of our community. More recently, with the help of Ricardo and other advocates, CMAR has also worked on trying to get undocumented students to pay in-state tuition and make them eligible for state financial aid. That happened, was it last year, Ricardo? 2 years ago? We're very happy that our undocumented children are now going to be able to get an education. It's not the same as the financial aid they get at the federal level, but it makes a difference. A lot of more children, we expect, are going to be coming to the University of Washington and to other universities as a result of that law. Social justice and public health are intertwined. You can't have one without the other. The University of Washington School of Public Health values includes equity and courage. The School of Public Health teaches students to gain a better understanding of socioeconomic status, class, race, and social determinants of health. These underlying themes help shape my perspective on how health and social justice work together. But of course, I am one of many. Graduates from the School of Public Health fight for health and social justice from a local and a global perspective. There are tens of thousands of them working in our healthcare system, making a difference. Previous distinguished alumnus recipients have led efforts against global AIDS, against malaria, conducted suicide research and prevention in China, advocated for legislation that require hospitals to provide life-saving care to everyone, regardless of ability to pay, advocated internationally for women and children health, and trained Vietnamese physicians about HIV/AIDS, clinical care, and drug treatment, just to name a few. They have all one thing in common: a focus on health with the ultimate goal of social justice. I want to conclude by saying that I've been involved in a wonderful journey. Who would have thought that a migrant farm worker who worked in the farm fields of Washington and California could attend one of the best universities in the world and graduate from one of the most prestigious School of Public Health in the country? Then, to be recognized by the School of Public Health for the work that I love doing, it is absolutely wonderful. I am humbled, ladies and gentlemen, for the recognition I received tonight. I will receive the award on behalf of all 2,400 employees of CMAR Community Health Center, the individuals that make it possible for our health center to do its courageous work. Thank you very much for hearing me out. Hopefully, I was able to share with you my background, my experience, and how much fun I've had working in the field. Thank you very much. Thank you.
We will have a Q&A. I think Rogelio and myself and many others want to applaud the students in the back for your signs and making your opinions heard and known. Thank you. I'll ask a question. The mayor, Norm Rice, used to ask really hard questions in a very soft way. But I would ask you a question that he probably would.
Okay. All right.
You've had an incredible career. But let's assume you were back being a student again. Mm-hmm. And you were looking at all the issues that we face. Tell me about some of the issues you feel that we are not doing well and what more work has to be done.
Are you asking from the perspective of the university or perspective of the community?
I am asking both.
Both? Well, I think from the university perspective, I think we need to do more work in diversity. Underrepresented minorities, I think we're not there yet. I think we need to work a little harder to get that number up. But the faculty and staff, I think we have a lot of work to do. And that's one of the issues that was before us back in 1969. As I mentioned, we took over President Odegaard's office as a result of that. It is kind of sad for me to see that the same issue is being discussed today. As a region, I'm going to pay special attention to that, and it's one of my it's one of my hopes, that working with Regent Harrell and Regent Rice and others, that we're going to be able to make a difference in that area. From the community perspective, I think that we need to be more involved with the students that are here today. I think a lot of times as students, when we come to the University of Washington, we leave and we go on with our business of surviving and doing work and raising a family. I think we could do better in staying in touch with students and mentoring them, helping them with some of the issues that they face. I think the community also needs to push the university a little harder in terms of race and equity issues in terms of procurement. And so we're going to be addressing some of those issues. When I became a region, I didn't become a region just to be a one-issue region. I'm very interested in healthcare. That's one of my passion, of course. But I'm also interested in law. I'm also interested in social work and political science department. I have a broad perspective, and I plan to work really hard. It's been a great experience for me. I mean, I've been learning a lot. It's a lot of work. I didn't realize how much work it was, but this is a very big and complex organization, and I needed to learn. And I haven't learned everything, but I know a lot more now than I did 2 years ago. I'll tell you that much. But that's what I see.
Oh, I got several more.
Okay.
Is anybody written a question? I want to make sure that I get any written questions. There's one coming. You know, when I was sitting listening to you, what just made you so unrelenting? What made you so unrelenting? You just kept going and going and going.
Yeah. Well, I think it's how I grew up. I had a tough life growing up. It was not easy, and I know that there's a lot of children out there that are facing the same problems I did when I was growing up, not only in rural areas, but in inner cities. And so my passion became healthcare when I got involved in organizing that clinic in Othello. And I developed a passion that I can't let go. I mean, some people ask me, when are you going to retire? And I'm saying, well, not now. I'm not done with the work that we're doing at CMAR. And the work that's being done at CMAR, of course, is not just me. It's the rest of the 2,400 employees. But there are people out there that serve as role models. My good Mayor Rice here, he was one of my role models. In fact, Norm gave us some furniture when he was with Rainier Bank. He gave us some really nice furniture. We wanted to have a modern healthcare facility, and he gave us some really nice executive chairs. Thank you, Norm.
If I am a student and I am wondering, and I have a dream, and it looks impossible. Tell me about how you accomplish the impossible.
Well, nothing is impossible if you're willing to work at it. That's what it takes. When I came to the University of Washington, I graduated with a 2.6 GPA. I mean, that was my GPA. Most of the students that were being accepted at the University of Washington, they weren't 4.0s or 3.8 the way it is now, but it was high. It was somewhere in the 3.5, 3.6s. So I was one full level away from the students that were here. But that didn't concern me because I knew that I was going to come here and I was going to work my behind off to be able to compete. Other classmates of mine that had similar grades didn't do that. And it took a little courage. I mean, I was afraid, but Chicano floor, we have a Chicano floor here, made it easier for me. And so the advice I will give the students, if you're having a difficult time, is to seek help. There's help out there. If you're a student, you're having a difficult course, there's people that are willing to tutor you. There's educational assistance by the Office of Minority Affairs. Don't be shy about asking for help. There's nothing wrong with with accepting somebody else's help. I did that. I mean, I struggled in some of my classes. In fact, economics is an interesting decision for me to go into. When I was meeting my prerequisites, I took Econ 200, I think it was, and didn't know anything about economics. I mean, I was fresh out of the farm. I mean, I didn't know what business was. I didn't know anything. But I needed it because I needed that class, and so I took it, and I had a hard time with it. I think I ended up with a C in that course. And then Econ 201, gosh, I thought 200 was hard. 201, 201 was much harder, and I actually ended up getting a D in that class. But I said, I'm not going to give up. I'm not going to give up. And I kept at it. And after that, because, economics, you take the introduction courses, and I think a lot of the fields are the same way. You take the economic courses, they're tough because they want to weed you out. They want to discourage you from continuing because they don't have room for everybody. And so I decided, no, I can handle this. And after those 2 classes, my grades were just, I think all of them were A after that, because those 2 classes set the base, for the rest of what you're going to learn. And so don't be afraid. I would tell the student, don't be afraid about taking a class. If you don't know what you're passionate, you gotta look for it. And how are you going to find your passion if you don't try something different? You have to go for it, and don't be afraid to ask for help.
Just a few more questions, and these are from the audience. What is the UW going to do to enroll more students of color, especially Latinos, into the School of Medicine and Dentistry?
Well, we're going to ask you to help us. That is a problem in that we're not recruiting well in Eastern Washington. And this past December, I took Provost, I can't pronounce, Baldesty, Jerry. I took him to Eastern Washington so that he could meet, some of the students, and we had a great time. WSU is out there just about every day or every week. I mean, they're constantly recruiting Latinos, because in Eastern Washington there's a lot of Latinos. And so what we need to do as a university, we are a state university. We're not a Western Washington university. We're not a Seattle university. We are a state university. So as a regions, I would like to see the University of Washington do some more work in Eastern Washington. I mean, we should have offices in Yakima. We should have offices in the Tri-Cities. We should have offices in Spokane. Now we have an office, but it's kind of tiny, but we got to make it bigger in Spokane. And so we need to recruit better than what we are currently recruiting. In medicine, I think that we're behind the 8 ball. The population in this state, Latinos have, is growing. I mean, we have the Latino community is a young community, so there's a lot of children. And so we're going to be one of the largest communities in this state very, very soon. And in the country, we're going to be the largest soon as well. And so we need to do some work in those communities. We need to recruit students. We need to train them in elementary school into the STEM courses or the STEM areas. There's just not enough teaching being done in the public schools. And so we have our work cut out. But when the students come to the University of Washington, and they do, not a lot of them, but they do in medical school. There's underrepresented minorities in the medical school. But you know what's happening to them? They are having to leave the area because they're not getting residencies in the state. So 60% of the underrepresented minorities are having to leave the state because they can't get a spot. With the Caucasian students, it's 60 to 70% finest lot in the state. So we need to do some work there, because you know what happens when they leave? Some other community ends up keeping them, because residents, when they are trained, that's where they end up living, because that's, they're there for 3 years, they develop relationships, they get close to the community, and so they stay there. So the University of Washington needs to pay attention to those things, and I would like to see Paul Ramsey, who is the dean of the medical school, I would like to see him go out there talking to these residency programs, because they're not all owned by the University of Washington. They should be talking to them and saying, wait a second, what is the problem here? I met a young resident that was graduating, I think it was 2 years ago, and he was the most articulate resident that I've seen in a long time. He got a master's degree in public health. He was in the middle of organizing a forum for minority students, high school students, to come and spend a couple of days at the University of Washington. And he invited me to speak to them. And I asked him, I said, where are you going to do your residency? And he says, well, I'm going to Salinas. And I said, oh, how come you didn't stay here in the state? He said, well, no, I wanted to go to Salinas because that's where I'm from, and I wanted to practice there. But he says, when I talked to, I think it was a share. When I talked to my share, I asked about the possibilities of applying to the residency program, and his response was, don't even think about it. I mean, what kind of response is that from a faculty at the University of Washington? That is unacceptable. How does he know he can't compete with the other students? And so those are the little things that are occurring, in our university that's having an impact on how many minority doctors we're going to have working in our city. So that has to change. Now, I mentioned it to Dr. Ramsey. He kind of just, and so we're going to have to address it as regions. That is unacceptable behavior from.
This question is, what is the future of those undocumented students who graduate from the UW? Or I would say, what is the future, and how can the University of Washington help those undocumented students who graduate?
We got to get you to be in the Supreme Court of the United States. We need one more. We need one more member. Well, I think we're very fortunate that the state made some financial aid available for undocumented students. It's not enough. They're coming. They're having to work. They don't get the out-of-class experience because they're working. This holds true for other students as well. That's one of the big concerns that I have, is that when I was at the university, the state paid 80% of the tuition, and the students and families paid 20%. Now it's the opposite. Students are paying 80%, students and their family, and the state only pays 20%. And tuition cost obviously is very high. So we as a community need to work with the University of Washington. We need to go to the Olympia, develop a campaign, and we need new revenue. We can't take revenue from other human services. We need new revenue. It will be hard to do, but if everybody pushes, I think it can be done. Now, for undocumented children, I think the university can do more. We raised a lot of money. A lot of it goes, a lot of it is invested. I think we need to make more funding available for scholarships for undocumented children and other low-income children, even if they're documented, so that we can provide more financial aid. There is no other way. It does take money. we need to figure out a way to do more fundraising, I guess.
Your background and experience as an activist when you were at the University of Washington and your career similarly are very, very, very remarkable. And now you're a University of Washington regent. So how do you manage to take all of that energy and all that in perspective and all that experience and try to embed it into the culture of the University of Washington and its decision-making?
Well, all I can do is push and work hard. I mean, that's all I've done all my life, so it's easy for me to do that. Sometimes, sometimes I can be effective. Other times, I may not. But I think that the fact that we now have 3 persons of color in the region, I think is amazing. And I think that we have an opportunity, because sometimes when you only have 1 person of color in a board of 10, it's harder to get things done, and it's harder for other people to listen, because we all have different ways of thinking. And so the only thing that we can do as regents is to try to do the right thing for the right reason. And I think that we are beginning to see a difference. We need also the students. We have a group of students here that are very passionate about what they're doing. That's exactly what they should be doing. I mean, the students need to be pushing us and the community needs to help them so that we can begin to see some changes. Now, this organization or this university is a very complex business. I mean, it is a business. It's a business of educating young people and professionals. And it's very complex, and it's easier said than done. I mean, it's not, it's a tough job for President Cauce and the regents and the administrators that work here. It's not an easy job. I mean, they got to make the numbers work. And with the state bailing out, their job becomes so much more difficult. And that's where we can help as a community. If every alumni called at the same time or close to the same time, our representatives, they would pay attention. They would pay attention. And so that's what we need to do. We need to organize a campaign. We need to start making changes within the university. I am very serious about increasing diversity at this university. And it's going to happen or I'm going to die trying, I'll tell you that much.
I need to say this, though. Your Regents Board is nothing short of remarkable. I mean, there's a lot of challenges out there, but I don't think there's a Regents Board in the United States today who is stepping up to more challenges regarding diversity and of inclusivity and of smart investment and opening the doors than the University of Washington. So I want to thank the regents that are here. I want to thank you because I think they rock. They rock. People don't realize how really lucky and fortunate this university is and what it does. I want to thank them.
All right, buddy. Thank you.
Now for your last words of
You
it.
have a question?
Yes.
Ask a question. Hello, my name is Palka Shibale, and I'm here with a group of students today from the School of Public Health, Global Health, from Electrical Engineering, from History and Philosophy, from the Sciences, to ask you, Rogelio, a question about divesting from prisons. So prisons don't disappear problems, they disappear human beings. Vast numbers of poor immigrant and racially marginalized communities are effortlessly being shuffled into prisons, mostly for nonviolent crimes. 2 million people are currently locked up in the US prisons and jails. More than 70% of those people are people of color. The fastest growing group of prisoners are Black women and Native American women. 58% of African American Hispanics are incarcerated, yet they are less than a quarter of the nation's population. I've got some statistics for you. 1 in 15 African American men are incarcerated. That is in contrast to 1 in 36 Hispanic men and 1 in 106 white men. African Americans are 12 to 13% of the population, but of that 2.2 million people who are incarcerated, they represent 37% of the prison population. And once in prison, because prisons are privatized, they are paid about 4 cents an hour to make things like all the furniture that you're sitting on today. The University of Washington has endowments in the millions in private corporations, some of the largest that we have seen in this country, like CCM. And we have millions and millions in these private prisons, basically perpetuating the prison industrial complex. We are perpetuating the school-to-prison pipeline, which is weeding out African Americans from a very young age, right? African Americans at this university only represent 3% of the population. Right? The Seattle right now is building a new youth jail, which will incarcerate students of color at a disproportionate rate. And you, as a board regents member, have the authority and you do have the decision. It is in your hands to make a powerful decision to divest from prisons. You have the power right now to make a vote for us to divest from prisons and invest in Black futures and invest in our populations, especially those of us who are racially marginalized. And that is why we are here today. You have told us a lot about the activism that you did in 1970, but I want to know, what will you do right now in 2016 to make a move to divest from prisons?
I didn't know that the University of Washington was invested in prisons. I'll certainly take a look at it. I wouldn't be supportive of that. This is sort of new to me. As far as the endowment, there is a need for endowment, and a lot of the endowment that is being raised by the University of Washington are endowments that are dedicated for certain things like scholarships. And so the money that's being earned by the funds that are invested are being used, for scholarships. They're being used to run the university, and so universities all over the country, have endowments. And you may think that that it's a lot of money, and it is, but the budget for the university is absolutely huge as well. I mean, you're talking $5-6 billion, and so if you take a look at what the university spends in 1 year, what they have invested is less than 1 year in their endowments, and it's being used correctly. And so I will take a look at how we invest in prisons, and I'm in agreement with you. I don't think I would like to see that. And I don't know how you invest in prisons.
Just one more.
Thank you so much, Rogelio, for sharing your story. I think we have a lot in common. I'm a daughter of migrant workers. My grandfather came to the United States as a bracero in the 1960s. Both my parents worked in empacadoras for citrus in California. I too got a degree in political science at UCLA, and now I'm here at the University of Washington pursuing an MPH in the Department of Global Health. However, there are problems. And you said social justice goes together with public health very well, and I do agree with you, and I appreciate all you did for our community. And you are doing. But however, every single time we confront the leadership about the lack of diversity in our programs, we're always told that it's a money issue. Did you know that I'm the only Latina student in my program, in my cohort, in the Department of Global Health, and we have no African Americans in my department? And I think this is similar all throughout the School of Public Health. So whenever we talk to leadership, it's always an issue of money. And I'm told that the regents control the purse strings. So I'm asking you, what do you pledge, or what can you tell us that you
Well,
would contribute to
I think
this?
that I already addressed that. I mean, that's one of my top priorities. I am interested in increasing diversity as you are. And so I don't know if you were here while I was speaking, but that is an important part of my job, is to look at diversity, make sure that we have it not only in the School of Medicine, but throughout the university. And I make that commitment to not necessarily to all of you, but to the whole community. That's one interest that I have. I think the whole university and the whole regions, I mean, they are concerned about diversity as well. I think we'll begin to see some changes, but change doesn't happen overnight. We all need to work together to make sure that it happens. You know, we need to make sure that our young children are being educated in the right areas. We can't have everybody coming in that's an underrepresented minority and going into the arts and sciences. We need to diversify. And we don't have enough children in the STEM programs within the University of Washington. And so we're talking the same, we're in agreement with all of this.
I just have one more question. Then.
Okay.
Your next Board of Regents meeting is 2 weeks from today. It's on May 12th. Would you be willing to address those 2 points, divestment from prison and increasing diversity among students at the University of Washington at that meeting?
I don't think I need to do it in the meeting. I think I can look into it without having to do it in the meeting. I don't think that the Board of Regents works that way, but I pledge that I'm going to look into it. I want to see what you're talking about, because I really don't know.
The one thing I can say about Rogelio is he's never, ever been a person who didn't keep his word. When he says he's going to do something, trust me, it gets done.
All right, well, thank you very much, ladies and
I want to
gentlemen.
thank all of you. Why don't you give him a big hand? Congratulate him on his honor.
Thank you all for coming tonight. Safe travels home, and see you soon.